The measles outbreak in the United States has now reached 17 states and Washington, D.C., and Pennsylvania is among those 17 states. The Centers for Disease Control and Prevention report that 121 people are now included in the outbreak that began in Southern California Disney theme parks back in late December. Last year, the U.S. saw 644 cases, the greatest number since the measles was eliminated in 2000. We talked with a local pediatrician to find out if the disease has arrived in our area.
The concern is theoretic. We have not had any documented cases to my knowledge, and I hope we don't get any.
Health officials across the country have attributed the resurgence to a growing number of people who have chosen not to vaccinate their children for personal reasons. And the discussion on whether or not to vaccinate is certainly a hot topic these days, with strong opinions on both sides. I talked further with pediatrician Dr. Steve Glicken from the Lehigh Valley Hospital, Hazleton. He feels strongly that all children should be vaccinated. Why is it so important to you, and why do you feel so strongly in that direction that children should be vaccinated?
We feel strongly about this on several levels. First, for the safety of the child. Immunizations have been one of the biggest forces for reduction of childhood mortality since the beginning of the 20th century. Secondly, for protection of the community at large. There are a lot of people out there either who are too young for certain immunizations, namely most infants below a year of age, and people who are immune suppressed because of things like cancer and medications that they may be on. So from the point of view of public health and individual health, it's extremely important.
Some people on the other end say, it's our right to decide what's good for our child, what's not good for our child. What do you try to maybe consult with parents or say to people who say that?
Well, unfortunately, this has been studied pretty widely, and people who are dead set against immunizations in general do not listen to reason and do not listen to scientific fact. Occasionally it does work, and I try to convince people to go with a regular immunization program. I think that it is an ill-advised decision. I think it is a wrong decision. One can argue that people certainly have a right to refuse immunizations for themselves. I do think it gets a lot stickier when you're talking about preschool and school-aged children.
Why is that?
Well, because if a child is not immunized, and we see something like has happened in border states with Mexico where there have been outbreaks of polio rarely, and where we're now seeing in California and other states outbreaks of measles, this puts unimmunized children and immune-suppressed children at terrible risk.
With all this going on in the Hazleton area, I know maybe you can't get into specifics, but is it here as well? I mean, are some parents saying, hey, we don't want this?
There are some parents saying that they are refusing immunizations, or that they want to have a special schedule of immunizations that, they have a variety of reasons, none of which make much sense to me. We currently are asking such patients to leave our practice.
And again, you have rights as doctors like they have rights as patients, you were telling me.
Absolutely. We can't cut people off cold, but we can give them a limited amount of time to either change their opinion, or if they maintain it, which I suppose is their right in Pennsylvania, they will have to find an alternate source of health care.
Now, are there, and I don't know all the science behind it and what we can get into in the short amount of time, but are there some risks associated with vaccination, like anything in medicine or like anything in life, really?
The risks of vaccines are very, very small. Almost never are they life risks. The whole question of autism has been buried in the ground innumerable times, but it's sort of like a zombie that keeps crawling out of the ground. And it's an argument that people use, and it is simply dead wrong.
How much politics should be involved with the medicine and that aspect? Does it conflict a little bit here?
Well, the Pennsylvania legislature many years ago gave parents an option of having a personal objection to immunizations and opting out because of that. So yes, in Pennsylvania they have a legal right to do that, but that does not mean that we have to either encourage it or allow it in our practice.